Rachel is 26 years old from Carrboro, North Carolina. She was pregnant for the first time and received regular prenatal care. At 32 weeks, she started experiencing headaches and swelling, but her doctors dismissed this as a normal part of pregnancy. At 37 weeks, she began having seizures and was rushed to the hospital, where she went into an emergency C-section, and she and her baby fought for their lives. Rachel was experiencing undiagnosed preeclampsia, and she is not alone. My name is Denali Dahl, and I'm the CEO and co-founder of Kalia Health, a health justice startup dedicated to improving reproductive health outcomes for birthing people like Rachel. Preeclampsia is a pregnancy complication characterized by hypertension and organ damage that occurs in the second half of pregnancy. Globally, it's the second leading cause of maternal mortalities, affecting about 10% or 21.3 million pregnancies every year. And the US has the highest rates of maternal mortality of any high-income country, largely in part due to health disparities. Undiagnosed preeclampsia is life-threatening. The complication progresses to a severe stage of eclampsia, which involves organ failure, seizure activity, and fatalities. And preeclampsia is difficult to diagnose. The early onset of preeclampsia symptoms are pretty subtle, meaning that people are unaware of the complication until it has reached a severe stage. And the current diagnostics are inaccurate, misdiagnosing about 30% of cases, and they're inaccessible, as they must be performed in a clinical setting, which is a barrier to many. The cost of undiagnosed preeclampsia is huge, impacting the US healthcare system at $2.18 billion every year. However, early detection saves lives, and preeclampsia is straightforward to treat and manage when detected early. And so that's why our team is developing a home-based early detection test for preeclampsia. The idea is that birthing people can periodically self-screen for the early onset of the complication so they know when to seek medical care before the complication becomes severe. The test functions similar to a home pregnancy test, where urine is applied to one end of the strip, and the user gets a binary output, either positive, yes, you're developing preeclampsia, or negative, no, you have a normal pregnancy. There are a number of competitors in this space working to improve the accuracy of diagnosing preeclampsia. However, none are on the US market, and all are for use in a clinical setting only. Our test is the only test that can be used at home or in a clinic setting, which uniquely positions us to provide a highly accurate diagnostic tool that is also highly accessible. To date, Kalia Health has demonstrated our proof of concept in a number of ways. First, from clinical data, we have validated the diagnostic potential of 2 urinary biomarkers with at least 80% sensitivity specificity. Second, we built a prototype lateral flow assay that can detect these biomarkers from fresh urine and converted our patent. Third, we've conducted over 400 interviews and surveys, and we found that 100% of clinicians listed preeclampsia as a top concern and stated that early diagnosis is essential. Our initial market is a prescription for home use model in the US, where individuals can receive a package of 10 test strips from their local pharmacy covered by insurance for routine screening at home. Eventually, we hope to expand at a lower cost in emerging markets so we can ultimately increase the number of people who have access to this technology globally. Based on our estimates of sales in high, middle, and low-income countries, there's a global obtainable market of $4.6 billion. And our profit potential is high. Based on willingness to pay data, we price these test strips at $30 each, giving us an 83% gross margin by year 5. My co-founder, Happy, and I are both engineers and global health researchers, and we are both passionate about using technology to improve health equity. All of this is made possible through our partners and advisors who are experts in clinical work and diagnostics. With reproductive rights under attack, it's more critical than ever that we work together to ensure that people have the care that they need. And so, on behalf of Kalia Health, thank you for supporting us as we work to improve reproductive health outcomes by bringing healthcare home.